the countdown. Hi, I'm going to guide you throughout this video. Now we are in a space, but we're moving to a space where we're going to learn about post-expiratory technique. Make sure to put your oxygen mask on. Let's proceed the countdown. What is meant by forced exhalation?
Forced exhalation means you doing your best to get a maximum breath out.
What is forced expiratory technique?
Forced expiratory technique is sometimes referred to as a huff. It's used to help secretions up the throat so it can be removed via mouth without pain of coughing. A huff is exhaling through open mouth and throat instead of coughing. Huffing helps to remove secretion from small airways to the larger airways where they remove by coughing, as coughing alone cannot help to remove secretion from small airways. When initially taught, patient is instructed to take a medium breath in and breath out from mild to moderate force and extended expiratory flow with the glottis open.
If huffing does not sufficiently remove your secretion, you should add coughing. You might need to cough if it successfully clears your secretion, but prolonged coughing should be avoided because they can be exhausting, make you feel out of breath and cause tightness in your chest or throat. Benefit of forced expiration technique is it is less painful than coughing, less tiring than coughing, and it has less effect on pressure inside the skull than coughing. Forced expiratory technique is good for a person who find coughing difficult and exhausting, such as those who has just undergone surgery. Since coughing has negative impact on pressure inside the skull, forced expiratory technique is preferred for patients with head injuries when it comes to secretion removal. Other respiratory conditions in which forced expiratory may be proved beneficial include emphysema, chronic bronchitis, current chest infection, chronic obstructive pulmonary disease, or we can call it COPD, bronchiectasis, and cystic fibrosis. We will show you the indication for forced expiratory technique.
Okay, for indication is post-surgical or pain, which is a rib fracture. Next is chronic increased sputum production, example in chronic bronchitis. Next is asthma, poor expansion, and lastly is mechanical ventilation.
Next, we're going to tell you the precaution that we have to take before we're doing forced expiratory technique.
Okay, for the precaution is inadequate pain control when needed. Next is bronchospasm. Lastly is acute unstable head, neck, or spinal surgery.
As you can see, there are many meteors in space. Just like how we want to avoid meteor, that's how we have to avoid contraindication. Next, we're going to tell you what is the contraindication for forced expiratory technique.
The contraindication of forced expiration technique is for the patient who does not spontaneously breathing, unconscious patient, patient who are unable to follow instruction.
You take a long breath in.
Cannot, my nose is stuffy.
And patient who are agitated or confused.
Now I'm going to show you the consultation between a therapist and patient who has bronchiectasis.
Hello, my name is Nakib, I'll be your therapist for today. Are you Mrs. S?
Yes.
Okay, so it's stated here that you are diagnosed with bronchitis. That's true?
Yes.
Have you ever heard of the word bronchiectasis? It is a long-term condition where the airways of lungs become widened, leading to build-up of excess mucus that can make the lungs more vulnerable to infection. The common symptoms of bronchiectasis include persistent cough that usually brings up a phlegm. So that's why the therapist is going to teach the patient the correct way to do forced expiratory technique because it will help the patient to clearing the phlegm more effectively.
Okay, so today I'm going to teach you how to do a forced expiration technique.
Okay.
Now the therapist is going to tell us the goals for forced expiratory technique.
The goal of forced expiration technique is to help force secretion up to the throat to be removed from the mouth without feeling the pain of coughing. I'm going to explain the procedure and demonstrate to you first. Please listen carefully. You can practice FFT by mimicking steaming out a window by using your hand. Breathe in and breathe out using your mouth. There are two ways to half cough. The first way is longer breathe in, short breathe out. The second way is short breathe in, longer breathe out. You may feel at some point you want to cough and clear up your phlegm.
Now it's the patient's turn to do the forced expiratory technique under the physiotherapy wash.
Okay, now it's your turn to do it. I will give instruction and guide you during the session. First, I want you to practice FET by using your hand. Breathe in using your nose and breathe out using your mouth. Once you get used to it, you can do it normally. There are two ways to half cough. The first way is long breathe in and then short breathe out.
Okay.
Now we move on to the second one. Short breathe in, long breathe out. At some point you might feel you need to cough and remove your secretion. Thank you Mr. S for your cooperation. You can practice this FET when you're feeling in need to remove your phlegm.
So it is the end of our video. Now we are going to conclude the forced expiratory technique.
It is concluded that forced expiration technique is more effective in enhancing tracheobronchial clearance. The forced expiration technique is a variable technique which is effective at clearing sputum from the larger airways. Forced expiration technique is an integral component of other airway clearance techniques, for example, the active cycle breathing (ACBT), and it may be more appropriate than the use of directed coughing in patients with unstable airways. Because huffing has been found to be more effective in the upright position, using the forced expiratory technique as a solitary treatment does not seem to support it. That is all from us. Thank you for listening.